Rocky, along with Conemaugh Health System, Somerset Hospital, and the Cambria County Drug Coalition, we've teamed up, as you heard us talk about, the fight against drug addiction, and it's our Hearts Against Heroin awareness campaign. Today we have Tom Chernisky. He's Cambria County Commissioner, Vice Chair of the Cambria County Drug Coalition. Thanks for coming in, Tom. Appreciate that, first off.
Good morning, Bubba. Thank you for having me.
Absolutely. Now, we're talking county standpoint. How exactly are you involved with the coalition?
Well, since 2015, from the start, from the get-go, myself, District Attorney Kelly Callahan, Sue Mann from the 1889 Foundation, Bill McKinney from United Way, Dr. Jenny Spencer and John Moykin from Conemaugh Hospital, Duke Life Point. In September, we started meeting back in November 2015, and from those meetings we formed the Cambria County Drug Coalition. And then also moving forward, fast forward, in September 2016, Ronnie Oblonsky became the executive director, and I serve as the vice chair, and Kelly Callahan, district attorney, serves as the chairperson.
Now, obviously, since you're an officer of the coalition, we know you're committed to making this change, as we all are, and making things happen. Now, what do you think, as far as positive change, do you anticipate from the whole collaborative effort?
Yeah, and collaboration, is a word, and but it's an actual word we're actually doing. Collaboration work. We're not just saying we're doing it, we're doing it. So the left hand knows what the right hand's doing, the right hand knows what the left hand's doing. It's going to take law enforcement, treatment, and prevention working together. Working collaboratively, we can work to decrease the supply of legal drugs in our area, improve systems of care for individuals struggling with addiction. We also need to enhance drug prevention with education initiatives in our schools, not just in our schools, our senior activity centers, the libraries. Educating people in the community. I pride myself in being out in the community, Bubba, and find out what people are saying. And I find out, there's a lot of opinions out there. Let them die.
Sure.
We need to help people. Not until you walk in somebody's shoes, not unless it's your son or daughter or brother or sister, not to have that life event, that experience, you make that decision. I think we need to do a better job as educating people about this disease. It's an epidemic, and it affects all walks of life: rich people, poor people, middle-income people. It does not discriminate.
Now, as everybody's coming together for this one common goal, give me some examples of the early success that you've seen.
Yeah, well, many sectors are working together, and that's huge success. When I say, because before everybody, they get in this silo, they work hard, and then that's what happens. But now these silos are the left hand is what the right hand's doing. And again, it's easy for me to say that, but we're actually practicing what we're preaching. But everybody knows what everybody else is doing. From medical education, law enforcement, this has been an epidemic that has impacted our entire community. Our community needs to unite and work together. Some early success or distribution of Narcan to all Cambria County police departments, the production of a 30-minute video and several TV commercials addressing heroin abuse, and it's linked to prescription drug abuse and HIV. A new marketing partnership with you guys, Forever Media Broadcasting. This in-kind marketing donation of $191,000 for 2017. We don't have enough money to pay for that and buy that of commercials. Basically, in these commercials that you guys are doing, it's covering Cambria County, the region. It's not just a Cambria County issue. This is a regional issue, state of Pennsylvania, United States issue. Educating people on prevention, arresting bad guys, and also rehabilitation. But I want to go back to Narcan. A lot of times people will say, let them die. We're bringing these people back 2 to 3 times, 3 or 4 times with Narcan. Now, I'm out talking to people. People are very opinionated on that. They'll say, let them die. The ones that say, let them die, through my experience, has not experienced a family member or a loved one through that process. The ones that experience a loved one and a family member, they have a different thought process. But also, I'll agree, this is my own personal opinion. When someone is brought back from Narcan, and first of all, Cambria County is one of the last counties in the state of Pennsylvania that allow our police or first responders to have Narcan. So it is about saving lives. Every life does matter. But however, we'll hear when someone's brought back from Narcan, we try to give them a warm handoff to one of those rehabilitation places, or the hospital, try to give us a warm handoff. Well, in my personal opinion, we shouldn't have a warm handoff. It should be a hard handoff. And a hard handoff is, if you get rehab, your life is saved from Narcan, guess what? You're going right to a rehab immediately. You have no choice not to go to a rehab.
That's right.
Because our first responders are studs. 2 in the morning, 3 in the morning, 2 in the afternoon, 3 in the afternoon. They drop everything and they go. No questions asked. And they save lives every day. But guess what? We're wearing them out. And these folks, again, I don't think they woke up and said, I want to be an addict. They got there for a certain reason, from an addiction problem. But now we should do a hard handoff. And I think for the hard handoff to happen, the law has to change. It has to be tweaked. We need to lobby our state legislation and say, hey, when someone's brought back, they need help immediately. They don't have a choice to go home and do it again.
Okay, now the main question that I look at in my mind is, what is the biggest challenge facing our community in the war against drugs for everything?
Okay.
The biggest challenges you think?
There's a lot of challenges, Bubba. Every aspect with this epidemic is a challenge. The first thing that comes to mind is decreasing the fatal overdoses. It's going to take all of our sectors working together to decrease the legal supply of drugs. Working to get folks treatment, educating our youth. We have to save lives. Every life does matter. We have to have an approach that's focused on the entire problem. It involves police, medical community, nonprofits, and our faith-based community. All hands on deck. And I really believe with all hands on deck, we can get things done. But it is educating the people about this epidemic and what it's all about. No one, again, wakes up and says, I want to be a user. I really believe that. No one says, I want to be a junkie. And they get to that point because of an addiction issue and other issues. And it does not discriminate. This didn't happen overnight, and it's not going to be cured overnight. Some of the things that I'm smarter today than I was a year ago. I'm smarter today on this issue than I was 5 years ago. What I do find out, we don't have enough beds available, because I understand when an addict is at the lowest point of their life and the family, and a lot of times they don't have any family support because the family disowned them,
right,
or a friend disowned them. But when they decide, when they want that treatment, that's why I want to say we should have a hard handoff. Just you get them the treatment. But when that person, individual, as the law is right now, when they want that help, there's a waiting list, maybe of beds for 5 days, a month.
Oh, really? It's that long?
Well, sometimes it is, and sometimes it's 4 or 5 days, because there's not enough beds, because this is a major problem.
Yeah.
So we need to be able to get people in rehabilitation sooner than later. I really believe getting them in now is going to save us. If you want to look as a taxpayer point of view, I really believe the long-term treatment facilities has more success. It costs us more money from the get-go, but it's going to save us tons of money later on, because historically the short-term facilities, the short-term rehabs, they don't have a major success rate. It's a Band-Aid approach.
Yeah.
30 days and 60 days, the success rate is documented. The longer approach, so it costs more money in the long haul. So that's just my personal opinion on that.
Well, thanks so much for coming in, and appreciate your hard work here. Tom, we're talking with Tom Chernisky, Cambria County Commissioner and Vice Chair of the Cambria County Drug Coalition, and it's our Hearts Against Heroin campaign. Thank you for being a part of it.
No, thank you. And I just want to finish up. Every life matters. Cambria County is a great place to work, live, and play, and it's all hands on deck, and we're moving forward. And thank you, Forever Broadcasting, for your contribution.
Hearts Against Heroin, presented by Conemaugh Health System and Somerset Hospital, with Spangler Subaru, Martin Baker America, Yeager's Heating Service, and First Summit Bank on Rocky 99.